Hi everyone, good afternoon. My paper is on pediatric outpatient department-based vision screening in children in a tertiary hospital. So pediatric vision screening is a crucial part of primary healthcare, and vision plays a major role in a child's development. The common ocular disorders that we encountered were refractive error, amblyopia, convergence insufficiency, strabismus, etc. So the pediatric OPD has not been commonly used as a target area for vision screening programs previously in India. So aim of our study was to assess the benefit of utilizing pediatric OPD as a target area for screening in children. So all children from the age of 1 to 16 years who visited the pediatrician's OPD underwent the screening. So a pocket vision screener was utilized and other additional tests were also performed. Children who had failed the screening tests were referred to the ophthalmologist, and more than half of the children did not review with the ophthalmologist. So they were interviewed via telephone to analyze the reasons. So the screening was done using a pocket screener, and the children were read from a distance of 3 meters. And in preschool and pre-verbal children, central steady and maintain method was utilized. For squint evaluation, Hirschberg corneal reflex test and cover tests were performed. To assess the extraocular motility, we used the H technique. So the results of a study were, in total 800 children were included, and the age group was 8 years plus or minus 4 years. The gender was almost equal, and around 84% of the children had only passed the test, and out of the 127 children who had failed, only less than half of them reviewed with the ophthalmologist. So some of these children were symptomatic, and the common symptoms were headache and blurred vision. Others were frequent blinking and eye irritation. So some frequent systemic associations were developmental delay and speech delay. Around 1% of these children had strabismus, and exotropia was found to be twice as common as esotropia. And other incidental ocular pathologies that we came across were amblyopia, nystagmus, lid swelling, unilateral 6 cranial nerve palsy, and Duane's retraction syndrome. So out of the 127 children, 69 of them did not review, and on probing we realized that the most common were loss of follow-up and unwell child, and other reasons were some of them took appointments for a later date and some were consulting elsewhere. So the study which is currently there in India was started in 1994, and the screening of middle school children. And by 2018, the primary school children were also included in the screening program. So some of the other studies we had compared were Sukla et al. Was a study done in primary school students. Here the drawbacks were the secondary school students were not included, and teachers found it difficult to examine preschool children. And a study done in Udaipur was done in government school setup and did not extend to private schools. And there was another study done in AIIMS, New Delhi, which was done house-to-house screening in 40 different clusters. This study was very cumbersome and a large manpower was required. And there was logistical issues. The Modest et al. Was the first instrument-based screening which was performed, and it had improved rates of complete vision screening, and it reduced largely the unnecessary referrals to specialists, and family satisfaction was superior. So the existing studies, the reported referral rates from 4 to 14%, whereas in our study, which was performed by trained ophthalmic assistants or optometrists, had higher referral rates, about 15 to 16%. However, the dropouts from reviewing with the ophthalmologists were almost similar to the previous studies. In several countries, it's mandatory that the children undergo screening from birth to preschool age and periodically thereafter in a pediatrician clinic. However, this practice is not common in India. So in conclusion, we highlight that almost 1 out of every 6 child that visited the pediatric OPD failed the screening process, and we analyzed that more than half of these children did not review with the ophthalmologist, the common reasons being loss to follow-up and child being unwell. So to the best of our knowledge, this is the first Indian study to look at the pediatric clinic as a target area for vision screening and to identify vision problems in children. These are some of my references. Thank you for your patient listening. I would like to take this opportunity to thank AIOC, and my consultant Dr. Gayatri J. Panikar, and my HOD Professor Radha Namrai for guiding me through this process. Thank you.
Any questions on the judges?
No, sir.
Thank you.